Hello, this is Dr. Margaret Owolabi. I'm reporting to you from the decks of Animal Care Technical Lab. And our lab will deal with livestock, fishes, poultry, pigs, basically livestock. We have different ranges of livestock animals we receive here or samples to mitigate on most times issues bordering about the health of the animals and their productivity. Over time, we have realized that antibiotics administration is usually not needed when we have issues. We've seen that managemental issues, nutritional issues, among many other things could be the reasons why you're having those problems: mortality, production, reduction and decline and all. So I decided to put this together for you. I'm going to share two case scenarios with you. Okay, let me start with this client that had parent stock broiler. He experienced heavy rainfall and immediately began to notice cocci signs, bloody feces. So when he got to the lab, he was concerned. He was wondering if the cocci vaccine he administered was broken, meaning, is it still working? When you administer cocci vaccine, what happens, especially if you are rearing on the floor, that's the deep litter method of rearing, you are not supposed to give anti-cocci throughout that period. You're supposed to just manage the litter. You cannot discard of the litter, so you just keep turning it over, or sometimes you just spread near wood shavings on it, but you just have to maintain the cycle. So it was surprised. On opening up the birds, I first noticed these birds were already struggling with a chronic health issues. You could see it from their liver to their kidney and all other organs in their body. It was chronic. So definitely this wasn't from the heavy rainfall, and this is not cocci that I'm saying. I saw enteric lesions, sloughing off of the intestines, and a lot of factors like that. I checked the intestinal scrapings under the microscope, and I did not see any humoral cyst or any other thing that could point at coccidiosis. So he had lost 70 birds that day, so we had to treat symptomatically. So with livestock, anything that has life, you need to act immediately. And in this lab, when we run tests, let me just show you what our e.t.c looks like. This is our e.t.c plate. I'm sure if you look very closely, you would observe some clearance, some zone of clearance. You will see this place is large, this one is small. You would see like here, there is a plate here, but there is no clearance. See this one, there is a very, very tiny, almost invisible zone of inhibition. Now, this is what we call, this is basically e.t.c test, antibiotic sensitivity test. What we do is we have a primary culture. When you have a primary culture and there is the first growth, what we do is we now do a secondary culture on something like this, then place antibiotics embedded disc on it. That is what gave you this. This is what it's. This is the results after 24 hours. Now, I would still give some explanation for you to understand what I just described. Now, I want to show you, this is an empty disc. I have not loaded it with any tissue organ or tissue impression. If I pick the splits, now it's opened up and I just leave it, I expose it. I expose it to the hair, or I take a swab from my saliva, I put it here. Of course, I'm healthy, there's nothing wrong with me. Something will grow. Something will grow. It will grow. Now, and I pick that, I do a secondary culture and I impregnate it with antibiotic disc. So definitely there will be area of clearance. It wasn't as if I was sick, or it wasn't as if we have any problem. So meaning that there are bacteria everywhere. There is what we used to call normal flora. Yes, meaning that we understand that there is a particular level of availability in the environment, but it is when it's beyond what it's when it becomes an anomaly, when the load is heavier than what it should be. Why I'm explaining this to you is because definitely something will grow. The only time where we see an obvious case where there is no growth is either when we are dealing with a viral case or perhaps the fungal case or managemental case. But even with what I described, something will grow. So if you come here, we don't give antibiotic the same day. We have to wait till the next day to recommend based on what I showed you. But dependent on what we see while doing postmortem analysis, we will pick some lesions that will not need to be attended to immediately. For instance, if a bird is having respiratory lesion, we know we need to give something that has menthol, because even a small child that has catarrh, even if you are giving whatever antibiotics you are giving, you know you have to give something to the airway. You know you have to give menthol, you have to give nasoangins, you have to do hot and warm water compress for the child to clear the airway. So, and like if we are saying an hepatic compromise, we might have to give liver tonic. So basically, that's what we do when we have dependent on what we see on PM. So I recommended a gut enhancer because there was real sloughing off and a lot of hemorrhage there, and also an anti-coxsackie drug that has vitamin K, because it was obvious there was already bleeding. We need to stop the bleeding. That's what vitamin K is for, because when you are treating for coxsackie and you don't put that in mind, it might just be an effort and futility. But mind you, we are not even dealing with coxsackie because I've done my confirmatory diagnosis. I didn't find any cyst under the microscope. Push forward. By the next day, that's 24 hours, I sent antibiotics to be used to him. I got a call 2 days later. He was like, "Doctor, my mortality has crashed. I'm not experiencing mortality, so I'm afraid to use antibiotics." So I looked at my results and I realized that we already isolated 3 different fungal species. Now, for fungal isolation, we need minimum of 42 hours. Sometimes it may take 72 hours or more, depending on the species we are dealing with. But at 48 hours, we had seen Aspergillus niger, Aspergillus fumigatus, and Candida. So I was like, okay, how well and good. If you are not comfortable using the antibiotics, it's not needed, however. But let us move in and deal with the fungi. When we were talking, mortality has stopped. He already received succor. So I gave him I recommended an antifungi, which means that he only used antiparasitic drugs, which was what I gave him the first day, and he called to thank me that mortality had subsided. So meaning for that man, we used antiparasitic drug and antifungal drug. He did not need to use antibiotics. So that's the case. That's the settled case. Remember, 70 mortality now. Let's go to the fish farmer. I received the call from I call him, is not a fish consultant, it's a sales rep for fish feeds. So he called me that he needed to service a client. He cannot find our enrofloxacin anywhere. That what is happening? I asked him, what do you need it for? there was a client that had lost 1,000 fishes out of 5,000 that he needed something for him ASAP. I begged them to please bring the fishes down to the lab. That when it comes, I will explain. On opening the fish, sorry, I keep interchanging it. On opening the fish, there was strict jaundice. Yeah, and I also noticed parasites in the gills and the arborescent organs. So it was just like, doctor, I cannot go back to meet that man without something to give him. You must do something for me. But as my rule, I don't recommend offhand. If you can come to meet me in the lab, why not wait? What happens when I recommend a drug for you? If that drug that I recommend offhand without tests, if it happens that this test did not, let me pick, okay, this is one, you can see this is oxytetracycline, and I think this is a Genta. Just if you look closely, compared to others, you see that there is minimal, as in minimal zone of inhibition here, very small compared to these ones. So I must have shortchanged you. You would have lost a lot spending money and you might not get results. So that is why I tell you to wait till the next day for the results. Obviously, they were losing a lot of fish, so we thought about what to do, and we decided to go for a blood enhancer, a blood booster, because a heavily jaundiced fish is losing blood at a very fast rate. So I told him to get a blood booster. It's very scarce. Of course, you could get it for small animals like cats, dogs, even large animal, cows. There is always a preparation, but there's hardly a preparation for aquaculture and for poultry. It's very, very, very scarce. But the guy went all out to look for it, and I had to recommend an anti-parasitic drug too, because I found cysts, I found worms. Would I call it worms? I found parasites, yeah, in my examination. Now, they couldn't get anti-parasitic drugs. I even feel people in the pharmaceutical industry, pharmaceutical industry, should really look at some drugs for the livestock. He couldn't get that day, so I had to order directly from the company, which would get to my place the next day. So it was left to look for the blood booster. So by the next day, when he called me, so because he had to pick the other things, the something for the parasites, and he also had to pick antibiotics to use. So he called me and was like, doctor, mortality had crashed. Mortality had crashed. That what I recommended just worked like magic. I found it hard to believe. I said, are you sure? Did you use any other thing? Have you gone to buy Enro that you will be looking for? He said, no, he has not. That after all, is just about to pick the anti-helmintic drugs I recommended. So, that case. Interestingly, Enro was resistant. That Enro he was looking for up and down was resistant. It picked streptomycin. One, they already received succor without any other drug, just the supplement. So now, with this 2-case scenario, we were able to salvage the situation without antibiotics. So many a times, this supportive therapy might be all you need. Sometimes you might need to introduce the antibiotics, but my point is, don't be quick to use antibiotics anyhow on your farm. If you need to use antibiotics on your farm, just do the routine, do the test. Just go and do the test. In that way, you are saving yourself money, because you'll be spending too much Even the smallest flock, you want to treat for a 1,000 birds, you use for 5 days. It has a cost implication. You want to treat fishes with antibiotics. It's usually expensive because most time we treat fish through water. It takes a lot of expertise to treat through feed. That will minimize cost of your, and you won't be getting sucker. The birds and the fishes won't get better. The livestock won't get better. So what's the point? So just bring your carcass to the lab. Get a professional. If you can't come to the lab, let the professional know that I tell them, get a professional, but let the person know, insist you want a lab test done. Tell the person you will foot the bill differently apart from his own charges. Now, let me now just explain what the sensitivity disc looks like. Like what I've shown you that, but let me, there is this kind of diagram I did to explain. Now you see this one, this is the largest, this is large, and this is small. What is in the middle here is the disc. Now I tried to do an arrow to indicate the zone of inhibition. This is the largest, this is the widest, this is wide, and this is small. Now most times, okay, this is, yeah. Now most times, we recommend the one with the widest zone of inhibition because it will work more, it will work better. We go for the ones that are not so big if we're already having tentative diagnosis that tend towards a particular type of disease, maybe if it's enteric, maybe if it's respiratory. So there are some antibiotics that are specific for those kind of lesions. So maybe that is when we would recommend something else. Now this is another diagrammatic representation. Now this is a disc. You can see there is nothing around, meaning why I said nothing around, meaning there is no zone of inhibition, meaning these antibiotic discs were not able to tackle the bacterial growth, meaning the organisms grew and had the swell time. These antibiotics will not work if it is used. Now this dot represents that it was cleared initially but started growing back. That's why you can first see the zone of inhibition, then the dot indicating that it's grew again. Now this has a clear zone of inhibition. This antibiotic will work perfectly well. This will work but not perfectly. You might have sucker for a while, then you realize that the birds begin to die back. Like they might stop or they might reduce, but before you know it, they are showing the same signs again and they begin to die. So now that I've explained that, I hope you understand where it's not advisable for you to just go to the market. The birds are dying, and you go to the market and pick. Now, beyond all that, why you should be very careful with using antibiotics in anyhow, you shouldn't use it indiscriminately, it's because at the end of the day, it's still coming back to us. We don't respect withdrawal period here in Nigeria. We don't. And over time, we are doing ourselves a very, very great harm, because tomorrow, when you really have to treat yourself for a serious infection, you might not respond because your body has built resistance to antibiotics. Even for the livestock, when they are really sick and they really, really need treatment, I've seen situations where we would do this split and no antibiotics could tackle bacterial growth. What happens to that farm? It will be difficult to treat. Then even apart from that, there's the poultry, the aquaculture sector is in a mess right now because cost of input has gone up. The poultry farmers try to increase their egg prices. Farmers, the middlemen are not buying and they have to drop it. So it's a mess right now. If you decide, you can think beyond, you can think beyond the shores of Nigeria. You can decide to export your meat birds, you can decide to export your fish, you can decide to smoke and export. It's very doable. Small youth, don't let me use children. Young people are doing it as side income. Export here, smoke fish, export. So you could do it. Instead of the market women coming to dictate price and they making more money than you that have put about 6 months of rearing and nurturing into it, it's our products won't be able to measure up with the international standard, because if they check, there would be a lot of antibiotic residues which they frown at. I had a client that we had to do a sort of waiver for. We had to run a test for them, which is not our return test, because they had a very large quantity of consignments on the highway. Is it highway? Yeah, on the high sea, sorry. About 20 containers of 20 tons shrimps. So, and it couldn't pass through because they wanted to know if those products were free of antibiotics. So we had to just do an internal waiver and do the test, because it's not a routine test and they had to get the kits themselves. So that test is called antibiotic residue test. What it does is pick quantitatively the antibiotic residues present in feed animals. Yeah. All right. So that's that about that. I hope you got value from this session. You could give us an idea of what you want us to talk about. We at the technical lab, what you want us to talk about, because we are like we are. I call I call us a resource center. We mix with a lot of clients and we know most things that obtains in terms of disease, in terms of latest way of treatment. So if you have anything that is bugging you and you want us to talk about, please, you could always drop it in the comment section. Let us know. All right. I am Dr. Margaret Owolabi. I represent Animal Care Lab Lagos. We have labs all over the country. We have in Abuja, we have in Asaba, we have in Kano, we have in Ibadan, we have in Ogiri. So anywhere that you have that is, just pick somewhere that is closest to you. I'm going to drop contacts of all the doctors there. So just you browse through, pick any one close to you and reach out to them when you have questions or you have issues you want them to attend to. Thank you.